New York might have undercounted COVID deaths in the state's nursing homes by as much as 50%. That's according to a new report from New York Attorney General Letitia James. NBC News investigations correspondent Tom Winter here now. Tom, that is an incredible difference and just horrible to think of how many people may have died in New York's nursing homes. What happened here? What is the AG saying?
Right. So a couple important things here, Allison, and we have to go back to the first wave of this pandemic. And remember, you and I talked so often back then, and it was just one awful headline and one awful story after another. When we go back to that time, there was an edict that was issued by the New York State Department of Health in line with federal guidance and CDC guidance that said, look, we anticipate the hospital situation to get really bad and not have enough beds. So if a nursing home patient goes to the hospital and is in a position to be discharged and be taken care of back at a nursing home facility, that should happen. So you should take a COVID positive person at the hospital. If they don't need to be hospitalized and put on a ventilator, then you should send them back to the nursing home. That turned out to be a bad idea. Now, there's a number of reasons for that, and you and I are going to discuss some of the issues with the nursing home in a little bit, and we can discuss some of those problems that led to that becoming a deadly decision. But essentially what we had happen here is that a number of people died at nursing homes. That order was then rescinded because it was such a problem at the nursing homes. The governor, New York Governor Andrew Cuomo, was heavily criticized for this. And so today's report says that when we look at the totality of the deaths, we're not going to find twice as many people died here overall of COVID-19. That's not what this is about. But when we look at what happened here today in this report from the Attorney General, it says, look, if you look at the pool of people that died, unfortunately, from COVID-19 that were elderly, that were at nursing homes, we're going to find that the amount that died at nursing homes versus other locations, that number is short by perhaps as much as 50%. And so that's something that's being taken a look at. Why was that reporting that way? And why did the Department of Health report it the way they reported, Allison?
So, Tom, you alluded to this. This report says that a, quote, lack of compliance with infection control protocols put residents at an increased risk of harm. What does that mean in plain English? And also in simplest terms, what are some of the other issues here that they're looking into? Right.
So, you know, one day people will put these types of things in plain English and I'll be out of a job. But until that happens, my research indicates and our reporting indicates, as we've been following this, something actually quite serious and quite grave. That essentially the basic protocols, talking about washing hands, talking about PPE use, changing PPE use after you work. You know, you visit somebody in the nursing home in one room. They may not have COVID-19 at all. You then go and visit somebody who's got as a nurse or as a healthcare worker who's got COVID-19, and then you go to another patient that doesn't. Are you taking that infection with you? Are you doing the necessary hygiene and cleanliness procedures that we can all now recite before you go from patient to patient, nursing home resident to nursing home resident? That was a major failure here. Another failure here coming right from the report, 76-page report, is that for-profit nursing homes' pre-pandemic low staffing model simply snapped under the stress of the pandemic. So it wasn't enough staffing that they had at these nursing homes to be able to take care of so many of these patients when they got hit with this awful, awful virus, Allison.
Tom, you mentioned Governor Cuomo earlier. He has not publicly commented on the report as far as I know, but New York State Health Commissioner Dr. Howard Zucker did release a statement that says the New York State Office of the Attorney General report is clear there was no undercount of the total death toll from this once-in-a-century pandemic. What are other top officials saying?
Right. So that was a 1,688-word, full-throated response to this. It is an issue that has been heavily criticized by New York State lawmakers. It's been an issue that's been heavily criticized by certain corners of the press and the governor's decision here. It's also an issue that was criticized by somebody who he kind of goes back and forth with. They don't have a great relationship with. That's New York's Mayor Bill de Blasio. Let's take a listen.
Yeah.
We have to get the full truth, and we have to make sure it never, ever happens again. Nothing like this happens again. And we have to be honest about the numbers.
So, Allison, to take people a little bit inside the New York State political scene, if you will, the two have not had a great relationship. It is a relationship that has been further strained by this pandemic, the decisions made by the governor, the attempted decisions made by the mayor here. So it's not surprising that the mayor would chime in on this. However, the mayor does have a point. There is going to be more of a more thorough investigation that continues here. The Attorney General alluded to that herself today, Letitia James. And so I think there's more information that needs to come out. Was this a lack of poor reporting by nursing homes who didn't want to get in trouble with the Department of Health? That's possible. Is it also possible that the Department of Health here tried to play hide the ball with deaths and something that the governor had been criticized? That's something that's going to bear further reporting and further investigation.
Yeah, Tom, thank you so much for explaining that relationship, that unique relationship, because those of us New Yorkers are very familiar with the fact that these are two Democrats who don't always see eye to eye on things. But I think people outside the state might not be quite as aware. And I just have to say, I think it's going to be a very long time before we start getting reports in plain English. So I think of all of us, you may just have the best job security in town.
Probably right. Thanks. It is an important issue, and we are definitely going to stay on top of it.
We are so thankful that you did, and thanks for explaining it to everyone in terms they can understand. We appreciate it, Tom.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.